Kathy Moreland, I hadn't known until we were organizing this event, and so we had a chance to meet the other night as a group. And Kathy is recently retired registered nurse and professor of nursing. And while her background is in cancer care, her passion for harm reduction and the current drug crisis is personal. Kathy lost her 18-year-old son, Austin, to fentanyl poisoning in June of 2020 here in Waterloo Region. She's an active member of Moms Stop the Harm, a group of family members fighting for changes in drug policy, and an active advocate for harm reduction and education of politicians and healthcare workers with the Registered Nurses Association of Ontario. So Kathy, thank you very much for being here this evening and sharing your story with us.
Well, thanks for having me. It's hard act to follow after going after Michael, but I'm really pleased that he sort of gave the macro overview of what's been going on. And so in the time I have, I thought I would talk a little bit about more of that micro that you're asking about. What's that upstream thinking and what does an integrated strategy for harm reduction look like? So I've got a few slides too, because pictures always help explain a lot of things better than what we can do. So I guess what I want people to think about is think about harm reduction like having an umbrella, and that each panel of that umbrella represents something different. So when we talk about upstream thinking and the prevention, I'll go into a little more detail in a minute, but just think of the yellow panel as sort of that prevention piece. And then the next panel being a safer supply, because part of the reason, as Michael alluded to, that so many people are dying is that the drug supply that's out there right now is not anything like we've seen before. It's not just heroin. It's not just cocaine. We've got I think last time, and somebody might be able to clarify this in chat, last time there's about 8 different types of fentanyl circulating out there. And on top of that now, the fentanyl is being laced with all other types of substances, including xylazine, which is a very strong benzodiazepine, which cannot be reversed by Narcan. And so you've got people who are experimenting for the first time, or casual users who are using these drugs that are killing them on the spot. And so when we start talking about substance use, I think everybody in this webinar is probably in this town hall probably has some form of substance use, because all you have to do is go to any Tim Hortons on any given morning to know that many people are addicted to caffeine or to sugar or to their Facebook reels, their TikTok reels, whatever, that these are illicit substances that have no control. And so it's important. Another panel I think that's really important to address in an integrated strategy for harm reduction is support for people who use these substances and their carers. That includes those people who are working at the CTS sites, people that are supporting our marginalized in shelters, people who are unhoused. These people need a lot of support as well. The decriminalization of simple possession, and you mentioned, Ron, that it's happening in British Columbia. The amount that they used is probably not what the people who are using would have wanted, but it's a start. Certainly consumption and treatment services is more than just someone having a place where people can, at this point, inject drugs. This is a link to social services and help and relationship and caring that is definitely needed. And the other part, and I get into arguments with people who like to think of harm reduction as that treatment is not a part of harm reduction. I like to include treatment as part of harm reduction because depending on which literature you look like, 60 to 90% of people who go into residential treatment for opioid struggles will relapse within the first year. And so to me, anytime you're not taking these unsafe substances is harm reduction, and you're making progress. If you wish to stop using these substances, you're making progress. I also need to point out, just so people know, that alcohol is still the #1 killer in terms of substances in substance use in this country. So just to give you a little more detail on what each of those panels of an umbrella would look like is, Michael's already mentioned the attention to the determinants of health, to prevent and identify appropriate, accessible treatment of trauma, because we know that there's a strong link between early childhood trauma or trauma of any kind and difficulties with substance use, timely access to children, youth, and adult mental health services. And certainly I have to put my plug in there for the prevention of fetal alcohol spectrum disorder. Both of my children are adopted and have fetal alcohol spectrum disorder. And certainly Austin's impulsivity, the symptoms of his FASD, made it that much more difficult for him and made him much more vulnerable to substance use. Support for people who use drugs and their carers. This is about education and educating anybody who will listen about relooking at our attitudes and the treatment and community resources that are in. We want to have consultative teams apart for those people who are caring for people who use drugs or people with substance use disorder, because those are two different things. Not everyone who uses illicit substances actually has substance use disorder. In fact, I think the last statistic I saw is 30% of the deaths that are occurring right now are amongst our construction worker people. These are functioning, working people who are recreational drug users. And because the supply is so unsafe, it's killing them. So there's a lot of potential for burnout and PTSD in this frontline workers. And I think that needs to happen too. Safe supply, you've mentioned already that the arguments. I become livid when I see politicians using stigma and stigmatized attitudes about drug use as a weapon to gain votes. I guess that's as politically appropriate as I can be right now. I struggle with that, and it doesn't matter what party, but certainly there's one party right now that's touting that that we know that safe supply prevents accidental drug poisoning. And when someone asks me, well, don't you believe that giving people safe supply is what's the word? Oh, I'm enabling someone's drug use. I guess that's the word, that we're enabling them. No, I'm keeping them alive. To be honest, I'm keeping them alive. And let's look at some of the reasons they're using. Maybe they've tried many other pharmaceuticals and they don't get any relief from their mental health issues, whatever. And the other argument about, well, people who get safe supply sell their supply. I think if they're selling their supply, it's because they're either not getting enough supply, they're not getting enough of a dose, or maybe they need to pay for housing because they don't have a house to live in or a place to sleep or eat or those sorts of things. I think there's a lot of anecdotal information out there that's very troubling. The decriminalization, again, this is where we get into, there's 3 levels of government that are looking at these strategies. And so in order for a city to decide that they want to decriminalize simple possession, they have to go to a federal government to ask for that permission. And then you might have a provincial government that's going, yes, but our police department isn't going to follow that. And it just becomes, this is where the quagmire of complexity comes from, is that you've got different levels of government with all different agendas. And of course would never say we want people to die that use drugs. But nobody can take that accountability because it's so complicated. These safe consumption sites or consumption treatment services, it prevents hospitalization. It saves money. If you can't support CTS because it saves lives, then think about how much money it saves you as a taxpayer, because it prevents people from going into the hospital, prevents people from getting hepatitis, and it prevents people from leaving needles in your back alley. So I've had people say to me, well, I don't want that in my backyard. I live 5 minutes from the CTS, and I have never had people in my front yard with throwing needles around. And I think the CTS probably kept my son alive longer than he would have lived had it not been available to him. And so I think people need to realize, when you say not in my backyard, sorry, people are in your backyard. In fact, you might be working with someone who's using and has to go to the CTS. And this gets me into that stigma thing, that not all people who use illicit substances are on the street, are living in tent city, or are, there are people that you are working with who probably are using and need to. So I think it's again, this getting your head around some of this stigma of what does someone who uses illicit substances look like. My son was well parented, people will say, well, how did he start in the first place? What parent does not let their 15-year-old go for a walk with his friend or his friend? And what happened with my son is he got introduced to some people, they introduced him to meth, and within 1 weekend he was addicted to meth. Because he said he had to take a number of medications through his lifetime for his FASD, and he had a lot of anxiety and depression as a result of that. And he said the meth was the only thing that actually made him feel better. So he had unfortunately found his poison that took him down a slippery slope, and then ended up using fentanyl when he told me his dealer told him that he didn't have any meth and that he should try this because he would be calmer. And convinced him that if he stayed within his limit, knew his limit and stayed within it, he would stay alive. And so
Kathy, can I get you to towards wrapping up? Sorry.
Yeah, I just want to show. So this is what by having that whole canopy covered, you got a greater chance of keeping people alive. There's not this. And what's happening with our current policies is, especially one that talks about so much treatment and you don't address all those other things, then you're going to have a lot of people dying still. And so that's why I try to use this visual when I can. I'm going to wrap up by saying this. If people really want to know what they can do to help this drug crisis, look inside yourself and think about how you were raised to believe about people who use illicit substances. Think about what the media portrays people that use illicit substances to be like, and rethink that, because not everyone, certainly some of the symptoms of drug use, of this kind of drug use, is not pleasant, and I've lived that. But we really need to recognize that of those 3,574 people that died in 2020, one of them was my son.
Yeah.
And those people each had parents and brothers and sisters and nieces and nephews and friends. And of the 107 in Waterloo Region, there's 106 other mothers in 2020 who lost their child. And so I think people need to recognize that this is a health issue, but it's become a political issue.
Yeah, Kathy, thank you very much for sharing that. And it just occurred to me that the more people hear stories like from yourself, and the more you're advocating like you are very much a superhero in knocking down that stigma. And people are recognizing that, yes, it is a pervasive issue. It can affect any and all of us. Not just the stereotypical situations that we like to imagine in our minds, but you're helping us broaden our thinking and broadening our thoughts on that. So thank you very much for that.